right, what is the most appropriate initial diagnosis to confirm suspected or diagnostic test to confirm the diagnosis? X-ray. Okay. Right, 58-year-old woman, history of rheumatic heart disease, presents with progressive dyspnea, edema, abdominal swelling. Physical examination reveals AVD distension, hepatomegaly. Auscultation of heart reveals high-pitched early diastolic murmur, heard best at the left lower sternal border that increases during inspiration. Okay, I always get these confused. She has rheumatic heart disease. Right away, I'm thinking like the Jones criteria stuff. Okay. High-pitched early diastolic murmur that is heard best at the left lower sternal border. Okay. What is the most appropriate initial diagnostic test? I'm really not sure what the diagnosis is. I mean, she has JV. Does she have JVD? Yeah, I think she's. Okay. I'm thinking like something like right-sided heart failure stuff.
Okay.
I mean, I know a chest X-ray, you're going to see a lot here as opposed to jumping to the electrocardiogram. So it's like, I don't know if it's the same idea as before when we were thinking, hey, that chest X-ray, it's cheap and fast and easy, and we could do it kind of quick as an initial diagnostic test, as opposed
So
to jumping to something a
what
little
did you
more invasive.
I guess my question is
I'm
what
just thinking it's something, I'm just thinking it's right-sided. I
so
don't know
so
exactly what type of murmur inside. I get
sure.
confused with those
Let's
a
break
lot.
the murmur down first. I think that's the best way, right?
Okay.
So the location is at what? The location is at the left lower sternal
Left
border.
sternal border.
Okay. And then also on top of that, right? Intensity during inspiration, right? And then also a high
Okay.
pitch early diastolic murmur. So that's going to give you a lot there, right? That it's a
Okay.
diastolic murmur. Um, so then also you add on top of that rheumatic heart, right? So that can be either, mitral, tricuspid kind of ordeal, right?
Mm-hmm.
Okay. It says left lower, so that's in the tricuspid area. Okay. So um it's probably a tricuspid area ordeal.
Okay.
So let's say, now that you've said, okay, maybe it's the, tricuspid, maybe it's tricuspid stenosis, right? Maybe. Okay, let's just say maybe. Okay.
Right.
Um,
Plus she has the JVD, like it all
yep.
that makes sense to me.
Okay. So let's say we're going with that. Okay. So now how do I confirm that though? That it's tricuspid stenosis?
That's
What's the
from
best way?
I'm not sure. I don't think it's a EKG, right? ECG is EKG, is it the same thing? I think so. Um, Chest X-ray, I don't want to throw out right away. Although I don't think you would see that
Okay.
stenosis. Um, I know if you do the catheterization, that's where you can get the exact levels, right, of the pressure
Mm-hmm.
of the chambers. I know that that would be helpful. I just know that that's pretty invasive. I don't know if that's an initial thing that you do right away.
Okay.
And then the transthoracic echocardiogram would probably give you the best image or something to see, but I'm really not sure of like how to, piece these together, which one's first or which one's next. I'm
Sure,
thinking,
sure. Yeah, some of these questions are difficult in that aspect, right? So
okay,
so let's work through it together, okay? So when I look at
okay,
this, I know it's a valve issue, okay? Likely it's the tricuspid valve, right? I would probably
okay,
bank it's tricuspid stenosis, so always go with the diagnosis first. Then now the question is, okay, so the tricuspid stenosis is causing all these issues, right? With the right side of the heart, right side of heart failure, JVD, systemic backup, etc. Right? So now the question is, okay, what do I want to do to confirm that? Because I have symptoms, but I don't have a diagnosis, right? And so the best
okay,
way is, I always think if it's a structural issue, which is the structure is the valve, the only way you can see that valve is likely an echocardiogram, right? in my mind, right?
Okay.
Physically to see.
Okay.
That's how I would pick it, right? But like I said, there's always,
Okay.
some skepticism when you're dealing with initial diagnosis tests, right? Because, maybe definitely for sure an MRI of the heart in my mind is too expensive. It will give you what you want, but why would you do an MRI if you can probably get the same information with an echo, right? Which is just an ultrasound,
Okay.
right? Cardiac cath, like you said, that's really freaking invasive, right? It'll give you your pressures,
Mm-hmm.
but that's very invasive. ECG, right? Minimally invasive, right? It gives you the electronics of the heart, but it can
Right, but
probably.
we're not really looking at that kind of problem, right? It's really a valve
Exactly,
problem.
exactly.
Okay.
And it'll probably show you that the right heart is bigger than the left through the electronics, right? Because obviously you have right side
Okay.
heart failure. And then the chest x-ray, that's gonna give you probably a little bit more enlarged of a right heart, but you can't tell like the valves, right? So I think, if I were to go through this, I would bank, 70% that it's probably D is the answer.
Okay.
Does that help kind of how I work through that with you?
Yeah, that makes the most sense because it's still imaging and it's not as invasive as the other things. And then my only question is like, why would it not be chest X-ray? Like why?
Yeah, because the chest
Um,
x-ray, so with the chest x-ray, can you see the valves of the heart? That's my question for you.
no,
You cannot,
no,
right? So a
no.
chest x-ray will give you minimum information, right? You cannot confirm that which valve is messed up and how the heart is. Like, think about what an echo can give you, right? It can give you
Okay.
multiple things. It can give you the size of the heart. It can give you the dynamic flow of the blood. It can give you the valves, how it's stenotic, how there's vegetation on it. It can give you so many
Right.
things, right? It can give you even you can watch the heart beat, right? And so it gives you so much
Hmm.
more information with lack of radiation. Of course, right? There's no radiation, right? There is, I mean, there's a cost to it, right? But this is going to give you the best information and help, quote unquote, confirm the suspected diagnosis. Chest x-ray,
Okay.
right? If you get a big heart that's a little bit more enlarged on the right, can you confirm that it's a tricuspid issue?
No, you can just see that it's just like, okay, the right heart's a little
Exactly.
um like hypertrophic or something, and there might be some fluid buildup, but that's all it's going to tell you.
Yeah, you're not going to really confirm much, right? If anything, right,
Okay.
it might give you the same information, right? So
Okay. Okay.